Alpha-thalassemia. Alpha-thalassemia, a thalassemia is a form of thalassemia involving the genes HBA1 and HBA2. Thalassemias are a group of inherited blood conditions which result in the impaired production of hemoglobin, a molecule that carries oxygen in the blood. Normal hemoglobin consists of 2 alpha chains and 2 beta chains. In alpha-thalassemia, there is a quantitative decrease in the amount of alpha chains, resulting in fewer normal hemoglobin molecules. Furthermore, alpha-thalassemia leads to the production of unstable beta-globin molecules, which cause increased red blood cell destruction. The degree of impairment is based on which clinical phenotype is present, how many genes are affected. Signs and symptoms. The presentation of individuals with alpha-thalassemia consists of cause. Alpha-thalassemias are most commonly inherited in a Mendelian recessive manner. They are also associated with deletions of chromosome 16. Alpha-thalassemia can also be acquired under rare circumstances. Pathophysiology. The mechanism sees that a thalassemia results in decreased alpha-globin production. The excess B chains form unstable tetramers called hemoglobin H or HBH of 4 beta chains. The excess G chains form tetramers which are poor carriers of α-thalassemia since their affinity for α-thalassemia is too high, so it is not dissociated in the periphery. Homozygote α-thalassaemia, where numerous G4 but no globins occur at all, referred to as HV-BARTs, often result in death soon after birth. Diagnosis. Diagnosis of alpha-thalassemia is primarily by laboratory evaluation and molecular diagnosis. Alpha-thalassemia can be mistaken for iron deficiency anemia on a full blood count or blood film, as both conditions have a microcytic anemia. Serum iron and serum ferritin can be used to exclude iron deficiency anemia. Types. 2 genetic loci exist for a globin, thus 4 alleles are in diploid cells. 2 alleles are maternal and 2 alleles are paternal in origin. The severity of the thalassemias is correlated with the number of affected globin alleles. The greater, the more severe will be the manifestations of the disease. When noting the genotype, laboratory diagnosis. Initial laboratory diagnosis should include a complete blood count and red blood cell indices. As well, a peripheral blood smear should be carefully reviewed. Hemoglobin analysis is important for the diagnosis of alpha-thalassemia as it determines the types and percentages of types of hemoglobin present. Several different methods of hemoglobin analysis exist, including hemoglobin electrophoresis, capillary electrophoresis, and high-performance liquid chromatography. Molecular analysis of DNA sequences. DNA analysis can be used for the confirmation of a diagnosis of alpha-thalassemia, particularly for the detection of alpha-thalassemia carriers' deletions or mutations in only 1 or 2 alpha-globin genes. Treatment. Treatment for alpha-thalassemia may include blood transfusions to maintain hemoglobin at a level that reduces symptoms of anemia. The decision to initiate transfusions depends on the clinical severity of the disease. Splenectomy is a possible treatment option to increase total hemoglobin levels in cases of worsening anemia due to an overactive or enlarged spleen, or when transfusion therapy is not possible. However, splenectomy is avoided when other options are available due to an increased risk of serious infections and thrombosis. Additionally, gallstones may be a problem that would require surgery. Secondary complications from febrile episodes should be monitored, and most individuals live without any need for treatment. Additionally, stem cell transplantation should be considered as a treatment and cure, which is best done in early age. Other options, such as gene therapy, are still being developed. A study by Kreger et al. Combining a retrospective review of 3 cases of alpha-thalassemia major and a literature review of 17 cases found that in utero transfusion can lead to favorable outcomes. Successful hematopoietic cell transplantation was eventually carried out in 4 patients. Epidemiology. Worldwide distribution of inherited alpha-thalassemia corresponds to areas of malaria exposure, suggesting a protective role. Thus, alpha-thalassemia is common in sub-Saharan Africa, the Mediterranean basin, and generally tropical and subtropical regions. The epidemiology of alpha-thalassemia in the U.S. reflects this global distribution pattern. More specifically, HVH disease is seen in Southeast Asia and the Middle East, while HB Bart hydrops fetalis is acknowledged in Southeast Asia only. The data indicate that 15% of the Greek and Turkish Cypriots are carriers of beta-thalassemia genes, while 10% of the population carry alpha-thalassemia genes.